Across the United States, the landscape of cancer mortality is not evenly distributed. Instead, it follows a disturbing pattern, concentrated in regions with high obesity rates, chronic underinvestment in healthcare, and socioeconomic disadvantage. Mapping these obesity-linked cancer hotspots paints a sobering picture. Certain areas of the country are not just more obese, they are dying faster and younger from cancers that could often be prevented or caught earlier. This is not merely a coincidence. It's a slow-motion public health disaster driven by policy failure, economic inequality, and environmental neglect. Data from the CDC and cancer registries consistently show higher rates of obesity-related cancer deaths in the South and Midwest, particularly in states like Mississippi, Louisiana, Kentucky, Arkansas, and West Virginia. These regions are home to what researchers call the obesity belt, an area where lifestyle, poverty, and access barriers collide. Here, colon, pancreatic, breast, liver, kidney, and endometrial cancers claim lives at alarmingly high rates. Several factors make these areas uniquely vulnerable. First, many of these states suffer from persistent food insecurity and food deserts, where ultra-processed food is cheap and accessible, while fresh, healthy options are scarce. Fast food dominates the landscape. Heavily marketed, calorie-dense snacks flood grocery store shelves. High sugar and fat intake, combined with sedentary lifestyles and economic stress, create the perfect storm for obesity and, therefore, cancer risk. Second, these regions often have limited healthcare infrastructure. Fewer cancer screening facilities, longer distances to treatment centers, and a lack of specialists mean cancers are detected later, when they're harder and more expensive to treat. Rural counties, in particular, face dire shortages of oncologists and diagnostic services. Even when care is available, insurance coverage gaps or Medicaid restrictions prevent many residents from seeking early intervention. Cultural and educational factors compound the problem. Public health messaging around obesity and cancer often fails to resonate in these regions due to a lack of tailored communication, mistrust in medical institutions, and political resistance to regulation. Meanwhile, industries that profit from poor diets, fast food chains, soda companies, and processed food conglomerates continue to aggressively market their products without accountability. The data doesn't lie. Counties with the highest obesity rates often have some of the worst cancer outcomes. Yet, despite clear geographic patterns, few states have responded with the urgency required. Federal and state investments in obesity prevention tend to be scattershot, underfunded, and politically contentious. School nutrition programs, exercise infrastructure, and anti-obesity campaigns are often the first to be cut when budgets tighten. And in the places most in need, preventive services like mammograms, colonoscopies, and HPV vaccinations remain tragically underutilized. The warning here is simple. Where obesity goes, cancer follows, and in some parts of the country, it's already taken root. If we continue to ignore these hotspots, cancer will become less of a national threat and more of a regional catastrophe, devastating specific communities while others move forward. This will only deepen the already massive health inequities that plague the U.S. Geographic data offers more than just a diagnostic tool. It's a roadmap for action. We know where to intervene. What's lacking is the political will to treat obesity-linked cancer as the localized, preventable emergency that it is. We need to target resources, expand care, and regulate harmful industries, not with vague public service announcements, but with bold, place-based interventions. Anything less is not prevention. It's abandonment.